As I got toward the end of the movement book, I talk a lot about a movement problem as a central nervous system problem. But a lot of people imagine that graphic of a rotating brain and spinal cord. When I say central nervous system, basically I am talking about all the sensory input from the bottom of your feet and your hands. I'm basically talking about cellular memory. Muscles, I think, do have memory. I don't think that there's a thing called muscle confusion, but I do think there's a thing called muscle dysfunction, and we have pain memory, posture memory, and that's not all just a neuron up here. That's at a preferred length a muscle wants to set. We're not really confusing the muscle, and everybody hears us talking about stress, but I don't like talking about things unqualified. When I got to the end of the movement book, I said exactly what I thought would be our next metric. We've got this movement profile, and every one of us feels pretty good wielding that sword. We do what we got to do in our trenches with that. But we also realize that stress and neurological inappropriateness in a certain situation drive that. So every one of us wants a tachometer that tells us when the human system is redlining. What I did is I looked at capnography, the way we're breathing. I looked at heart rate variability. Not how many beats in a minute, but how those beats are distributed through that minute. That is actually a profile of your neurologic stress. And the way we're capturing movement in the movement screen is not conscious movement. A lot of people who can't squat are not conscious of that. Most of what we're capturing in the movement screen is a brief snapshot of your autonomic nervous system when it's surprised by movement and can or can't do it. Your autonomic nervous system is responsible for about 98% of what you're doing because you're only thinking about one thing. It's beating your heart for you. It's making you take a breath when you didn't think about it. It's blinking your eye when a fly flies by. It's doing all that stuff. I left that thing in the back of the book. I'm not an expert on it. I'm looking at it because I think our next metric is looking. The word heart rate's in there, but the heart is simply the tachometer that talks about the amount of neurological stress that we're in at the time. And I don't think the movement screen and heart rate variability are separate things. I think it's the same thing peering in from two different windows. Exact same house. So when I see movement dysfunction, I usually see inappropriate stress responses to physical load, competition, or activity. And so, you know, if we can fix it from one end, we can fix it from the other. But I think having two windows, and a couple of years from now, there's a third, there's a fourth window, but they're all windows that get us right back to 4,000-year-old advice. Move competently, don't forget to breathe. It's yoga. And they always make sure you have a posture or a pattern before they get complex on that. And they always make sure you get control of your breathing before you try to move better. We know those two things. That's the movement screen, that's heart rate variability. So. You started playing with it this year, and looking at it. And yeah, it's like a laboratory. But no, it's neat. When you see a bad movement pattern, you're also going to see an inappropriate stress response to a movement that shouldn't be stressful, especially at somebody at the level you're coaching them at.
Well, you can see it. With somebody maybe sitting up here, the four of us, and you say, let's see this movement pattern, and you see hesitation or what? You want me to do what? I think my heart rate just went up.
Yeah.
Because there's a feared perception of your brain kind of saying, I don't know if I can do that. Matter of fact, I know I can't, but how am I going to get around it? Give me a minute here. I got to think of how I'm going to compensate my way through this, which is stressful. And I think, you know, Gray touches on something that I've seen through the years. And we're fortunate and unfortunate at times where we may get a player that comes to us who is coming off a significant injury, maybe 2 years ago or a year ago. Let's say an ACL, and he's fully rehabbed, he's been cleared, he's good to go. But one side of his body is very dysfunctional because maybe the type of rehab he went through to get him cleared was more of a joint isolation viewpoint of, let me make sure I've restored good stability, good mobility in that knee joint, the graft looks good, he's doing everything, he's cleared. But at during that process, we neglected the foot mechanics, the ankle mobility, the hip function, the core function, as it all relates to movement. We looked at the knee like it was the radiator on a car, took it out, replaced it, and the car will still run good. The body doesn't work that way. And to be able to take somebody through different neurological patterns after 18 months, where he has lost that pattern, and within 6 to 8 weeks he's changed, it can happen that fast if you turn the right circuits on. And the human brain, I think, whether you're one of us up here or you're the high-end elite athlete, obviously the elite athlete is compensating better than we could at 100% because the neurological system they have is so advanced. So if we can tap into that neurological system and do the right things, imagine how fast rehabilitation comes, or how fast performance training improves when we get into the right circuits.
Yeah.
And that's what Gray's system and his correctives do.
Well, and the other thing that I think we all embrace is, a lot of people hear us talk, go right out and start doing a lot of correctives. They don't realize our first order of business is actually deleting a stressor or a negative, removing a negative, whether it's somebody who's sleeping 4 hours a night and you guys know why they're not recovering right, whether it's a ACL patient that's recovered, been sent back, but basically is doing way more competition than restoration, stuff like that. So the very first thing we do is not corrective. It is basically saying, what are some of the things that are easy to remove that are compounding this? Because what literally I think the first batch of people who embraced part of our message did is they went out and injected correctives and didn't disturb this program. There's a lot of stuff here. I don't want to disturb that. Well, what you wind up doing is let's say it's 3 steps forward, 2 steps back. You do make progress in putting correctives, but allowing somebody to continue on mileage they don't deserve, or to do a lift that obviously is causing more stress than it is revealing condition. So each one of us, I think, almost intuitively now looks at what you're doing, looks at your past medical history and some of your other habits, and if you screen poorly, the first thing we do is say, what can we remove? How can we educate you? These come automatically before we go to corrective, and most people who come to our workshop want the keys to the library for all 750 approved FMS correctives, and I'm like, I use about 4. I use about 4. That new book, Why We Get Fat, has one statement in it. You don't get fat because what you eat. You get fat because what you don't eat. Yeah,
That's huge.
So, and I literally think we're at this point in our knowledge of what we think a workout is, we're probably creating much worse screens than people who used to bale hay and mine coal for a living and stuff like that. So,
Yeah, gets back to the organic movement principle. We're really trying to force movement on people. I think that it's interesting whenever we start to bring out heart rate variability. We've talked about movement variability from a biomechanical model and whether too good is bad or too little is bad, and we probably agree that there's a good window, right? We're nice physiologic variability is concerned from a movement standpoint. And the idea of combining some sort of physiologic measure in a rehabilitation setting has always been very difficult as opposed to like RPE or even with heart rate. It's always difficult to monitor, and I think that now the technology is developed, we can start to look at that. But the first reflex that I get from people when I start combining heart rate variability and movement is like, well, what do you mean? You're dealing with an orthopedic issue, you're dealing with a cardiovascular issue. I said, that's fine, let's just see how you squat. So let's do a wall squat. Okay, you're not a 3, I know that, right? Because your rear's not below parallel. So here, let's just check out your heart rate, right? I'm gonna help you get down, rear below parallel. What do you feel? I don't even care what your joint angles look like, just tell me how you feel. And it's this autonomic reflex that they haven't been there for years. And so to think about the fact that there isn't some sort, and then we see the same thing, we put a heart rate monitor on someone. Heart rate's through the roof all of a sudden. We see massive changes in the variability. So I think this is really, as you mentioned, Jeff, really that additional piece. It's really going to start to promote performance, rehabilitation. When is someone really compensating through movement as opposed to really owning that movement so we can progress them? When is the right time to progress someone? Right? If their variability is too low, where they're really stressing through that, not yet. Let's go on to something else, let's reset you, whatever we gotta do. But that additional piece is really gonna be meaningful as we begin to understand more the relationship between those two pieces.
And it's no different than when you go to the doctor, white coat effect, blood pressure. It is a test, but yet that's okay if you're sitting on a chair or at school taking a test. You know it's gonna, imagine playing on Sunday, Saturday, Friday night. That does count tremendously into the equation. It's just a matter of tapping into it, understanding recovery from that. But it is there, it is a phenomenon.
Yep. All right, well, I guess we could go on all day, but there's hydration, there's food, there's all these things that we want to do too, so I think we're going to leave you with that, and I hope that was helpful.